Hello, my name is Shweta Gore, and I am an associate professor in the Department of Physical Therapy at MGH Institute of Health Professions in Boston, Massachusetts. The study that I will be discussing today is titled Associations Between Physical Activity, Systemic Inflammation, and Hospital Admissions in Adults with Heart Failure. This study was co-authored by two of the Doctor of Physical Therapy students, Victoria Bayer and Chloe Melton, and an orthopedic physical therapy resident, Joseph Colello. Heart failure is a major health concern affecting 6.2 million Americans. Frequent hospital admissions associated with heart failure make it one of the costliest chronic conditions. In terms of prognosis, systemic inflammation indicated by elevated levels of plasma high sensitivity C-reactive protein has been linked to worse prognosis with higher hospital admissions and mortality among patients with heart failure. Physical inactivity has shown to be strongly and independently associated with the risk of developing heart failure. In contrast, in those who already have diagnosed heart failure, there is less clarity on whether physical activity participation could lower the systemic inflammation burden and reduce risk of adverse events such as hospital admission. Given that at least half of the population with heart failure follow a sedentary lifestyle, this study sought to investigate the association between systemic inflammation and frequency of hospitalizations, and to examine the association between varying levels of physical activity and C-reactive protein levels and frequency of hospital admissions in those with heart failure. So to do this, we utilized data from the National Health and Nutrition Examination Survey, which is the NHANES, in this observational cross-sectional study. We included all community-dwelling adults who had physician-diagnosed heart failure. NHANES is a cross-sectional, ongoing national study conducted by the National Center of Health Statistics that collects data on socio-demographic variables, clinical and lab profiles of non-institutionalized US populations using interviews and physical examination. So from 2 cycles of NHANES data, we extracted demographic information, including age, sex, race, education, and income. We then extracted clinical information, including BMI, waist circumference, smoking status, self-perceived health, presence of chronic conditions, and a variety of lab values. And then finally, we also extracted physical function variables such as difficulty walking, climbing stairs, lifting, carrying, and standing up from an armless chair. Our primary indicator variable was the average daily physical activity level. Physical activity data was obtained through a standardized physical activity questionnaire built within the NHANES. Physical activity level was characterized as sedentary, light, moderate, or vigorous activity based on the response to the NHANES physical activity questionnaire. The outcome variable assessed in this study included the total number of different hospital admissions in the last year and C-reactive protein levels obtained via blood samples and reported as numeric values. Associations between activity and hospital admissions were examined using Poisson regression. Multivariable logistic regression analysis was used for assessing the association between C-reactive protein and physical activity. So we found that of the 20,470 participants who completed the NHANES interviews in the 2 cycles, 9,818 participants were adults over 20 years, and 377 individuals reported to have physician-diagnosed heart failure with complete information on physical activity. We used the weighted analysis to describe our population in a nationally represented sample. And we also conducted the regression models as weighted regression models. We found a direct linear relationship between C-reactive protein levels and hospital admissions, with higher levels of C-reactive protein significantly associated with greater number of hospital admissions in heart failure. Similarly, participating in vigorous intensity physical activity was significantly associated with decreased expected rate of hospital admissions with an incident rate ratio of 0.38 and a p-value of 0.013. And there was a significant decrease in the C-reactive protein levels. So, to our knowledge, this is the first study using population-level data to examine the association between physical activity level, systemic inflammation, and hospitalizations in individuals with heart failure. The findings of this study demonstrate that irrespective of sex, engagement in physical activity at higher intensity levels is strongly associated with favorable outcomes in older adults with heart failure.